Thank you for joining today's Public Health Emergency Unwinding webinar. We will get started in just a moment. Will you be sure to mute yourself upon entry? And we look forward to kicking off our webinar shortly. Hi, everyone. I'm Deborah Johnson, the Deputy Assistant Secretary for External Affairs with ACF. I'd like to welcome you to today's important webinar and thank you for taking time to participate. Today, you will hear about the potential end of PHE, the public health emergency, which means millions of families and children have access to Medicaid and CHIP recipients across the nation, and how we can prepare our communities so that critical services continue for the children, youth, and families that ACF serves. I am going to quickly walk through the agenda for today's webinar and hand over the conversation, a welcome to our Assistant Secretary. So we'll have our welcoming remarks from ACF's Assistant Secretary, January Contreras. We will have Stephanie Costello with the CMS, who will present on the public health emergency unwinding, ways for ACF partners to take action, and then hopefully answer some good questions from you all as participants as a part of this conversation. With that, I would like to introduce ACF's Assistant Secretary, January Contreras.
Thank you very much, Deborah. I appreciate it. And thanks to everyone who joined this meeting, this gathering. We have a really important task ahead of us. So I'm January Contreras, the Assistant Secretary of the Administration for Children and Families here at the U.S. Department of Health and Human Services. Very privileged to do so. And today, I really do want to thank you for joining the webinar regarding our engagement plan at ACF for the public health emergency unwinding. And I know we often refer to that public health emergency as PHE. So we're holding today's event as a part of HHS's very large and very comprehensive, proactive approach to ensuring that eligible children, youth, and families will keep the healthcare coverage they need when the PHE ends. Our goal is to make them aware of the steps they need to take to maintain coverage. We have a lot of work to do to help the people in the communities that we serve become informed and ready to take action. So just some background, as you're probably aware, in March of 2020, when the COVID-19 pandemic began, the Centers for Medicare and Medicaid Services, or CMS, temporarily waived certain Medicaid and Children's Health Insurance Program requirements and conditions. They created a lot of flexibility in a time where there was a lot of need, and we were just at the beginning stages of this pandemic. The easing of those rules were important because they helped prevent a lot of people across the country with Medicaid and CHIP in all 50 states and the District of Columbia and the 5 US territories from losing their health care coverage during the pandemic. However, states will soon be required to start Medicaid and CHIP, the Children's Health Insurance Program, eligibility reviews again when the public health emergency unwinds. So although it has been recently extended until October, we're still looking at that moment ahead when the PHE does expire. Because then states will start to begin eligibility renewals again for most individuals in the Medicaid and CHIP programs. And that will be the first time they're doing eligibility renewals since March of 2020. So that's quite a while ago. People will have moved, contact information will have been outdated, and it's really important for us that we're helping the people in our communities be ready for those eligibility renewals when they do start again. Deborah mentioned the number of 15 million enrollees. So I just want to highlight that again. The possibility of up to 15 million enrollees, that's children, many children, young adults, other vulnerable populations, and individuals and families across ACF programs, they could be at risk of losing their Medicaid or CHIP coverage. So you, our ACF staff, and our trusted community partners will be a vital part of helping these families, individuals, and communities become informed and ready to take action to maintain these vital benefits and services that they're eligible to receive. Among other things, today's webinar will provide you with information about the Medicaid continuous enrollment requirements, efforts underway to connect people to coverage, strategies to engage people with Medicaid and CHIP, and resources that are currently available to prepare for the Medicaid and CHIP redetermination process. CMS has done a lot of work. They've been preparing for this for a long time. They have a lot of tools available to help states and communities really educate and engage individuals and families in their communities so that we can be ready for the end of the public health emergency. Of course, additional information will be forthcoming as we approach the actual expiration of the public health emergency. And we will provide any new guidance and resources to you as quickly and efficiently as possible to help you navigate the impacts to programs and service delivery. Again, I want to thank you for your participation in today's event, as well as your commitment to work with us to ensure that our children, youth, and families continue to receive the benefits that help them thrive physically and economically. So on behalf of ACF and all of HHS, I thank you for being a partner with us, for trying to help us keep people enrolled in Medicaid or CHIP, or to find other insurance. We must do everything in our power together to make this happen. So thank you so much for being a part of that.
Thank you, Assistant Secretary January Contreras. We appreciate those opening remarks and the reflections of the number of children and families that will be impacted. What we'd like to do now is have our CMS as subject matter expert, Stephanie Castillo, introduce several components for the impact of families and children.
Great, thank you all so much for having me on today. So I do have some slides that we're going to be sharing. Before I get started, I'll introduce myself. I'm Stephanie Costello. I'm the Director of the Partner Relations Group in the Office of Communications at CMS. So we do the stakeholder and partnership work. I do want to note that ACF holds a special place in my heart. When I started my federal career, I started in the Office of Community Services as an intern on the SSBG grant, and then was hired later on after I finished my graduate degree and worked on the Assets for Independence program, which unfortunately is no longer around, although also holds a very special place in my heart. So I loved my time at ACF, and I've been at CMS for almost 10 years since then, but I'm really excited to work with y'all, and I fully understand how important the role the grantees of ACF are going to play in this unwinding, and what trusted voices y'all serve to be able to get the messages out to the individuals and people on Medicaid. So with that, I'll go through my slides and we'll have some time for questions at the end. If you have questions as I'm going through the slides, just put them in the Q&A. And then when the presentation's over, I can go through and answer some of those slides. So what we're doing right now is we are preparing for the end of the COVID-19 public health emergency. And this presentation is focusing on what partners like yourselves need to know about Medicaid and CHIP coverage. So as we've heard a little bit earlier, that this public health emergency started in March 2020. And as a condition of receiving an enhanced federal matching rate, states have not terminated coverage for most of the individuals who enrolled in Medicaid. So this condition applies to states receiving the enhanced match rate through the end of the month in which the PHE ends. However, after the PHE ends, states will be required to resume their normal eligibility and enrollment operations, including by disenrolling ineligible individuals. Millions of people with Medicaid may need to take action to retain their Medicaid and CHIP coverage or transition to coverage such as the marketplace. We don't know when the public health emergency will end, but the Department of Health and Human Services has committed to giving states a 60-day notice prior to the end of the public health emergency. The public health emergency was recently extended until October 13th. So we do anticipate that 60 days prior to October 13th, we will hear from the Department of Health and Human Services about the public health emergency. But although the end date is unknown, HHS and CMS want to make sure that our partners are educated and prepared for this unwinding in the Medicaid and CHIP program once the public health emergency ends. We're dedicated to making sure that people stay connected to coverage, whether this is remaining on Medicaid or CHIP if they're still eligible, or transitioning to other coverage options such as marketplace coverage. Since many people enrolled in Medicaid and CHIP have not had to complete a full renewal process in over 2 years, if ever, we want to make sure that people enrolled in Medicaid and CHIP are aware that this is coming and that they work with their state agency to update their contact information, and that they're able to be reached when the state begins sending out their renewals. So just to hit this a little bit harder for y'all, some people who have entered into Medicaid since 2020 might have never had to actually renew their coverage. And they might not know that this is something that they ever have to do. If you've not had to do something for 2 years, you could imagine that it's quite a change if they find out that they have to renew. So there's a lot of communication that needs to be done to these Medicaid beneficiaries. Next slide. Just so you can see kind of what an impact this is going to have across the country for these CHIP beneficiaries. It's been a lifeline of health coverage for millions of people during the pandemic, due in part to the legislation that incentivized coverage for people to continue having coverage and have these flexibilities. Enrollment in both CHIP and Medicaid are at an all-time high. So that is an increase of over 17 million people. That's 24% since the beginning of the pandemic. Next slide. Much of this increase is due to the federal COVID-related legislation. So in March 2020, Congress passed a bill, the Families First Coronavirus Act, that established the continuous enrollment condition. States received extra funding for Medicaid in exchange for keeping most Medicaid enrolled individuals enrolled through the end of the COVID public health emergency, which we're still in. This continuous enrollment condition doesn't apply to CHIP, but many states implemented policy changes that also resulted in continued coverage for many individuals in CHIP. Every state and territory adopted these changes in Medicaid, along with temporary changes to CHIP policies. State actions have prevented beneficiaries from losing coverage during the PHE. It has also affected states' normal operation because they've not completed many renewals and redeterminations or terminated coverage for individuals enrolled in Medicaid. Next slide. So what happens when the public health emergency ends? When the PHE ends, the continuous enrollment condition will also end. States will need to return to normal operations, including renewals and terminations of coverage for ineligible individuals. It's this process that we're referring to as unwinding. States will have 12 to 14 months to complete the work needed to return to normal operations and complete renewals for all individuals enrolled in Medicaid, CHIP, and the basic health program. Our work together and the engagement of partners, community organizations, and advocates is critical in this process, in part because the volume of work, including renewals and redeterminations of eligibility, will be substantial in all states, especially given the increase in enrollment. This will be challenging for states, and the workforce and other burdens may increase the risk for people to lose coverage. It's estimated that nearly 15 million people could lose their eligibility for Medicaid or CHIP coverage. However, it's essential to note that this data does not mean that 15 million people will become uninsured. Many will be eligible for health coverage, including through Marketplace or other programs, such as obtaining coverage through their jobs. We at HHS and CMS are focused on ensuring that eligible individuals remain enrolled and that those no longer eligible for Medicaid and CHIP smoothly transition to other coverage. Next slide. What will the unwinding process look like in states? So as previously noted, states will need to complete eligibility renewals for everyone enrolled in Medicaid and CHIP or a basic health plan after the PHE ends. States will have 12 months to initiate renewals for their full population, their full Medicaid population. This is typical, and Medicaid and CHIP enrollees normally have their eligibility renewed at least once a year. However, while many states have continued to do renewals during the PHE, states have generally been unable to terminate enrollment for people they have found to be otherwise ineligible based on increases in income or other changes. States have been actively preparing for the resumption of normal operations, but they're likely to face some challenges. Volume is one of them. With increased enrollment, states will have more beneficiaries to renew, and this is likely to test the state's system capacity and the workforce. Like many other industries, Medicaid and CHIP agencies have lost staff during the pandemic and are working to hire and train new workers. Also, the length of time some agencies have been in contact with beneficiaries. It's been a long time since some people have gone through the renewal process, and states may have outdated mailing addresses and other contact information, which will be critical to ensuring that eligible individuals receive renewal information from their state so that they can retain coverage. Next slide. Now, for a little more information, this is on the Marketplace side. So we know that some individuals are going to be ineligible for the Marketplace, or excuse me, for Medicaid. And at that time, if a consumer is found ineligible for Medicaid or CHIP, their account is going to be sent to the Marketplace, to the federally facilitated Marketplace, as what we're calling an inbound account transfer. So when this happens, a paper notice is mailed to the consumer with instructions on how to apply for marketplace coverage. If we have an email address, an email is also sent. Individuals do not need to wait to receive the notice to apply for marketplace coverage. For example, if they don't think they have Medicaid coverage, they can go into marketplace. If an individual receives a notice from their state Medicaid agency that they've been denied or terminated from Medicaid, they are encouraged to immediately come to healthcare.gov to apply for coverage. Once an individual creates an account at healthcare.gov, they can start their new application and submit it. And if eligible, they can select a plan. So again, these are for folks who were ineligible for Medicaid. We encourage them to go to the marketplace. If they're in a state-based marketplace, even if they go to marketplace.gov and they list a state there, from the drop-down, it will take them to their state's website. Next slide. First, I want to note that anyone can apply for federal marketplace coverage during open enrollment, which occurs annually from November 1st through January 15th. But outside of open enrollment, individuals may qualify for a special enrollment period if they experience a qualifying life event, such as losing their health coverage. So this includes individuals who lose Medicaid or CHIP coverage who are eligible for an SEP to enroll in marketplace coverage. Individuals will qualify for an SEP if they attest to their loss of Medicaid or CHIP coverage up to 60 days before or 60 days after their Medicaid or CHIP coverage ends. CMS recommends that Medicaid and CHIP beneficiaries submit or update an application on healthcare.gov as soon as they receive the Medicaid CHIP termination letter from their state. Individuals do not need to wait to receive a notice from the marketplace to apply for coverage. CMS is also considering additional flexibilities to allow more time for consumers transitioning off of Medicaid or CHIP to enroll in the marketplace coverage during the PHE and unwinding period. Next slide. So what are states doing to prepare? They have actively been preparing for all of these challenges ahead, and many have been working for many months to ensure that eligible individuals remain enrolled in Medicaid and to support those who need transitions, like we just talked about, to the marketplace. So for example, CMS has encouraged states to take several steps, all of which most have. These include developing an unwinding plan to prioritize and distribute renewals when the PHE ends, obtain updated contact information, including addresses, emails, and phone numbers to ensure the individuals receive information on renewals, launch a robust outreach and communication plan to reach consumers and stakeholders, engage community partners, health plans, and the provider community to encourage individuals to update their contact information and to provide assistance with renewals. Most states plan to spread the renewals over 12 months after the PHE ends. A few plan to take less time, like 6 months, but CMS continues to work with them to minimize the potential coverage loss from the increased workload in shorter timeframes. Almost all states have continued to renew eligibility for some enrollees during the PHE. States that have not or are actively planning to restart full renewals and subsequently terminations of ineligible enrollees. Most states are implementing strategies to collect and verify updated contact information, and at least half are working with health plans. States have begun to launch outreach and social media campaigns to raise awareness about unwinding. And some states have also started to post their plans publicly. Next slide. We at HHS have also been focused on providing tools and resources needed to ensure a successful unwinding period. We've adopted an all-of-government approach, working closely with states and stakeholders like you and government partners like ACF to support the work ahead. If you haven't yet seen it, I would encourage you to check out our unwinding specific landing page at medicaid.gov/unwinding. There, we will have many resources, tools, and guidance to support both states and stakeholders. For example, you can find policy guidance, planning tools, and even a robust communications toolkit in English and Spanish for you to customize and use to share key messages with consumers, like update your contact information and check your mail. Next slide. In May, CMS also launched a consumer-facing page called medicaid.gov/renewals. This is for individuals in Medicaid and CHIP to learn about unwinding, to get connected to their state agency and find help. Medicaid and CHIP, people with Medicaid and CHIP providers and community partners can visit this page, select their state, and be directed to state resources. This page will be updated as we learn more about when the public health emergency will end. Next page, or next slide. We are dedicated to making sure that people stay connected to coverage, whether it's remaining on Medicaid or CHIP if they're still eligible, or again, transitioning to other coverage like the marketplace. These are our campaign goals. And through a multi-pronged whole of government communications approach, we're working to create a national outreach campaign that builds on states' efforts and engages deeply with partners and stakeholders. There are 2 phases to our current approach. We are currently in phase 1, which focuses on awareness, so that people with Medicaid and those who support them know that this eligibility renewal is coming sometime in the future and that they need to pay attention, ensure their contact information is up to date, watch their mail, and take action if necessary. Outreach will refresh once the 60-day notice is communicated, announcing the end of the public health emergency. Phase 2 will come once the public health emergency ends and eligibility renewals start. During phase 2, we will shift into making sure that people who are transitioning from Medicaid or CHIP to the marketplace are able to find coverage that meets their needs. Next slide. CMS has created a series of resources to help partners become more informed about Medicaid unwinding and to help support partners as they prepare and reach out to their audiences. On medicaid.gov/unwinding, you can find our Unwinding Communications Toolkit and graphics. The toolkit provides some additional context on unwinding that would be helpful, that we hope you find helpful for you and your colleagues on this topic of unwinding, or if you're working for people that need basic understanding of unwinding. There's some key messages derived from consumer research that we think will resonate well and are most understandable and will help consumers take action. These messages are woven into a variety of resources in the toolkit to help meet people where they are with options that will allow our partners to integrate them into their usual lines of communication with their audiences. Right now, the toolkit is available in English and Spanish, and we are considering adding some other languages. Right now, the contents in the toolkit include the summary of our research, key messages, a fillable digital flyer. Have you heard the news? So you can put that in your newsletters. Drop-in articles. We have social media and other outreach products. We have emails. We have sample text messages, and we have call center scripts. Again, this is available in English and Spanish. Next slide. These are examples of the tools available. Again, we have our social media graphics as well as some text. We have their drop-in article, and then we have our text messages. Next slide. So right now, partners should begin thinking about what you can do, your organization, in the coming weeks and months to commit to this work. We encourage you to think about how your organization may be helpful and how you may be able to connect with other organizations in your state, region, or community to reach people with Medicaid and CHIP coverage. We also encourage you to use the toolkit, resources we discussed, and begin incorporating information about unwinding into materials, presentations, and work plans that you have in development. Lastly, we encourage you to attend our HHS and CMS monthly Medicaid CHIP Continuous Enrollment Unwinding webinar series, which is the 4th Wednesday of every month. Our next call is set for August 24th. Want to reiterate that right now we are in phase 1. We really want the key messages for our partners to share to be these 3: to update your contact information, to check your mail, and to complete your renewal form. The toolkit itself has these very specific in there in the drop-in articles and then social media. But for you at ACF, our ask is that you're working with your grantees, and your grantees are working with people on Medicaid to make sure that they're doing those three things: updating their contact information, checking their mail, and completing the renewals. So that's all I have for my presentation. And we do have a set of these slides posted. I will have to follow up on the website for y'all and get them to you. I'll get them to ACF and they can email them out, but we do have them posted, and we have a similar presentation to the one I gave that my colleagues have given in the past, a recording of that posted, so we can share that as well.
Thank you,
Any other
Stephanie.
questions?
Thank you, Stephanie. What I'll do, there were a couple of more slides just for ACF to review with our stakeholders, and then we'll go into the Q&A session. So the action for families or individuals, as Stephanie has already highlighted, are to update their contact information with their state Medicaid program or CHIP, and to check the mail for a renewal form and complete and submit the form in a timely manner. This is a all hands on deck for our community partners in order to share this information with the families that you directly serve, because we can't do this work and bring the awareness to them without your support. And much of this partnership occurs within the organizations that are here present, where you're working directly with families to get them to have this information at hand. Next slide. And then some of the examples of how partners are sharing this information. We're asking that you train all frontline staff to ensure they are knowledgeable on steps to families to take to renew their coverage. Promote Medicaid and CHIP renewal on your websites. So the toolkit that has been shared and that's here on this slide, we'll send this to you. And we ask that you share this on your social media pages, share this on your websites, do as much engagement as you can with these printed materials, with these online materials. And if there are other ways that you think that we could get the word out, if it's doing phone calls or text messages or video messages, any of those that you think would be most helpful to your families, we will certainly employ those methods as well. And with that, we'll turn it over to our audience for any questions that you may have of either CMS or of ACF. I believe you're able to either raise your hand or pop those questions into the Q&A. I know one of the questions I'd seen earlier were the slides going to be shared. Yes, of course, we will have this information available to you all via email, but also in other languages as well.
I see someone asked if we could go back to the page to get the info on the slide. Is that for the toolkits? So I have that up. Hopefully that's the one they wanted. If not, let me know again in chat or in questions.
And we can drop some of the links in the chat as well. I'll look for those links to pop in the chat. Stephanie, this might be a question for you. Did I hear correctly? We don't have an expiration date as of yet?
So we don't know the exact expiration date yet. The public health emergency can be extended every 90 days. So this past July 15th, it was extended again until October 13th. So right now, the public health emergency is extended to October 13th. But it could be extended again. We don't know that. So that's why we don't know the end date for sure. However, the department has said that they're committed to letting us know 60 days before the end of the public health emergency. So, for example, if the public health emergency were to end on October 13th, that means they were going to end it and not extend it again. They would let us know 60 days before that. So that'll be mid-August. If we don't hear anything in mid-August, if it passes that 60 days, we could assume that it's going to be extended again for another 90 days, which I believe brings us to mid-January. So the public health emergency, when it was first declared in March of 2020, it has been extended every 90 days up until this point. And so again, what we're doing is just waiting to see what's going to happen, if it's going to be extended past October 13th, or if October 13th is going to be the end of the public health emergency. So mid-August, we should hear.
Thank you. I see that, as Stephanie shared earlier, that we are in phase one of this kind of campaign in order to ensure families don't lose coverage. But there is a phase two to this work that I see that maybe some of the other questions on ensuring that you're welcomed back to future conversations, because we'll talk specifically to the ACF flexibilities and waivers that could be impacted. So any of your email and contact information, we will have that, and we will be sure to invite you back for future conversations when there is maybe a firm deadline of when there will be an unwinding of the PHE. We'll hold for a couple of more questions if there aren't any.
There are a couple of questions in the Q&A if you and Stephanie want to take a look.
Stephanie, this might be a question for you. Are states required to publish their unwinding plans?
Again, I'm not the subject matter expert on this. I don't believe so. However, I do believe a number of them have published their plans. So you can go to the state's website to see which states have been published. I do not believe that CMS has a list of those that have published to share with you. So I do encourage you to go to your state's website or to contact your state and ask them if they have that plan and if they can share it with you.
And there's one other question of how do we work to engage and inform people who are unhoused, sheltered, or unstable housing?
Thank you. That's a great question. So we are working with a number of different stakeholders right now, and we have partners, national partners like Healthcare for the Homeless that we work with that work directly with this population. We also work with social workers and then other national partners that work with the homeless population. We also have, similar to ACF, we have 10 regional offices, and we have regional support. We have regional staff who are in those offices who are committed to doing outreach on this. And so they are the ones that have the partnerships with local or state organizations. So especially ones in big cities that have large populations that would fall into this. It's those our regional offices that have those relationships. And so they're working to give the information to those organizations. But we believe that on something like this, that's really that's something new, and that there's new in the sense that some people on Medicaid right now don't know that they have to update their information, or that there is going to be a renewal when the public health emergency ends. We want to make sure that they're hearing this message, over and over, and from a number of trusted voices. So if there's trusted voices that are ACF grantees, especially as I know y'all have like homeless and runaway youth programs, that y'all are working with this population, we encourage you to either, share that information and making sure that those individuals are updating their information, or that you're working with trusted organizations, that your grantees, for example, might have good relationships with those organizations who can reach these populations. Because we really want to make sure no stone is left unturned when we're trying to reach these people.
With that, we want to thank everyone for your participation. We hope that you have found this webinar useful and helpful to your outreach plans. We will continue to support you in any way possible in order to reach the 5 million children that ACF serves and are impacted by the public health emergency unwinding. And we'll send this information out to you via email. With that, we thank you. I'm going to conclude our webinar.